Hello, this is Dr. Kevin Tomassini from Spineandperformance, and today we're going to be talking about posterior pelvic tilt. What is it? What are the causes? And what can you do to fix it? Okay. So first thing, what is posterior pelvic tilt? Well, from the side, your spine should have three curves. One forward here on the neck, opposite direction, forward again. Okay. You should have a curve on the lower. This is called a lordosis. Now, posterior pelvic tilt is when your pelvis goes posterior like this, and this flattens out that normal curve of your spine. This is going to cause a lot of pressure on the disc of the spine, so they're going to get weaker, thinner, and that can lead to a slip disc or bulging of your disc or herniation of your disc, okay? And that can lead to degenerative changes. This usually happens when you have tight abs, tight glutes, tight hamstrings, weak hip flexors, weak quads, and weak lower back. So we need to strengthen the muscles that are weak, and we need to stress the muscles that are tight. Now we're going to go over the causes. One of the causes for posterior pelvic tilt is the way you stand. If you start hunching like this, your pelvis might tilt posteriorly. Now, this is when the head goes forward, your thoracic spine is rounded, your shoulders are rounded, and you're going to tilt the pelvis posteriorly, okay? So this is anterior, this is posterior, okay? So try to stand with your pelvis neutral, bring your shoulders back into position, head on top of your shoulders, and your pelvis neutral. Not anteriorly, not posteriorly, neutral like that. Another common cause of posterior pelvic tilt is the way you sit. If you sit for long hours in your computer and you're always hunching, and you go like this, you're actually putting your pelvis and your low back in a posterior pelvic tilt. So this is how it looks. You should be sitting neutral all the way back to the chair, but when you sit like this, you're doing this to your spine, okay? You're flattening out the curve of your spine and actually flexing the spine forward and bringing the pelvis posteriorly. So always sit all the way back to the chair, both feet on the floor, so you have a better curve and your spine is more relaxed. Okay, now we're going to go over some exercises that you can do to correct this condition, posterior pelvic tilt. The first one is going to be to stretch your hamstrings. You can do this standing up. So you're going to the front leg straight, you don't bend on your knee. The right leg, you can bend the knee a bit, and then you're going to tilt your pelvis anteriorly. And you're going to start to feel a stretch right here, okay? Don't bend your back, okay? You want to bend from your pelvis. So the movement comes from your pelvis, not from your lower back. Tilting your pelvis anteriorly, and you feel a stretch. So I'm going to do the right. I'm going to put my leg straight, bend this knee, and then go just like that. And you're going to feel the stretch right here. Going to hold that for 1 or 2 seconds, come back up, do 10 repetitions, and at the last repetitions, you're going to hold that for 10 seconds, okay? And repeat on the other side. Another area of your body that gets really tight when you have posterior pelvic tilt are the glutes and the piriformis muscle. And you can stretch those or loosen them up with a foam roll, okay? You're going to sit on the foam roll. You're going to bend the leg like this, like a figure 4. You put all the weight on the bottom of that leg, and then you start to roll up and down. All the glute, and look for tender spot. When you find a tender spot, try to focus on that area of tenderness and tension to loosen up the area. Okay? You can do this with a tennis ball or a golf ball. You're going to do the same thing. You're going to put it on the floor, and you're going to sit on that spot, and you're going to roll. Another exercise that you can do to stretch the glute and the piriformis is, again, put the leg like this and bring the knee to your chest. Hold it there 15 seconds, then go to the lower side and hold it. Another area of your body that gets really tight is the abs, okay? This right here, okay? So how are we going to stretch that? Well, you're going to lay down, facing down, okay? And pelvis is going to be against the floor, and now you're going to push up. This is called a Mackenzie or a cobra. You can start with your elbows. As you see, I'm bringing now a curve to my spine, and I'm stretching the abs at the same time. So hold it 15 seconds or 30 seconds, and then go up like that. So 2 things, bringing the curve back of your spine and stretching your abs. Another way that you can stretch your abdomen, your abs, is with a bowl. You're going to lay down facing up, and you're going to let your body go back like this. And you're going to feel the stretch here, bringing the curve back of your spine, and hold that. Pretty simple. Okay, now we're going to move to strengthening exercise, and we're going to start to strengthen the quad and the hip flexor. You can do this with a band. You can probably put it on your door or somewhere that you can hold it. You're going to put your foot right there, and you're going to bend and bring that up. Okay? This is a heavy band, so pretty hard to do. So you're going to bring it up and go down. Do at least 10-15 repetitions. If you find a lighter band better to start, then you can move on to a heavier band. The next exercise is the goblet squat. Okay, this is a good squat because this will load your quads instead of your butt, your hamstrings. Okay, you have anterior weight, so this will load your quads better. You're going to go down and come back up. Remember, the movement comes from the pelvis, not from the knees. Comes from the pelvis, and then you bend your knees and come back up. Don't bend your spine forward. Keep the nice curve of your back and go down and come back up. Okay, do 10 or 15 repetitions. Another good exercise to correct posterior pelvic tilt is back extensions. Okay, so you're going to lay down facing down. This is to strengthen the lower back, and you're going to lift your legs and your upper body. Hold it for a second and then go down. And then go down. Do 10 to 15 seconds. You're doing two things here. You're bringing curve of your spine, strengthening up your spinals and your lower back, and you're stretching a bit your abs as well. So, just like that. Another way that you can do this is with a ball. This is going to be a little bit more advanced, and this is going to work your core as well. You're going to put the ball on your pelvis, and you're going to go like this. Slowly go down, and then come back up, hold it a bit, and then go down. Make sure that you're tilting from the pelvis. If you pull the ball too low, then you're going to be using your hamstrings and your buttocks more. So I want you to use your lower back here, okay? So go here and back. Okay, so those are some of the exercises that you can do, some stretches, some strengthening exercises. Now we're going to go over the spinal traction and then the chiropractic adjustment. Now, most likely you have seen these devices on the internet, promising that this is going to get you out of low back pain. Well, this works for some cases. Posterior pelvic tilt is one of those cases. If you have anterior pelvic tilt, please don't do this. This is making it worse. But with this, you can increase the curve of your spine. So this is a type of traction. So you're going to put this on the floor, and you're going to put this right here on the curve of your back, and you're going to lay down like this. You can stretch your legs if you do this. This might hurt a bit, so start with your knees bent, okay? And you will feel a stretch on that area. It's good that you start on the minimum, and then when you can do at least 10 minutes, then you can bring it up to the next level, okay? Now, as chiropractors, we work with the alignment of the spine, alignment of your pelvis, your sacrum, your body, okay? Now, usually when you have posterior pelvic tilt, the sacrum, the base of the sacrum, this bone right here, this is the base of the spine, goes back, okay? So tilts posteriorly. So with chiropractic, you can realign the sacrum, realign the spine and your pelvis to correct this posterior pelvic tilt. So this is going to be done with my hands and a drop mechanism that the chiropractic table has. I'm going to put my hands here, boom, and I'm going to push the sacrum down anteriorly to correct that area. Another adjustment is you're going to be laying facing down. The sacrum is going back. I'm going to put my hands here. I'm going to do a side posture adjustments to correct the sacrum. And I combine that usually with the exercises to correct your posterior pelvic tilt and reduce the low back pain. If you like this video, don't forget to hit the like button, share with your friends, and subscribe to our channel for more health tips. We have another video about anterior pelvic tilt, posterior pelvic tilt, and lateral pelvic tilt, so you can get your pelvis corrected, reduce this low back pain, and enjoy your workouts. Again, this is Dr. Tomassini from Spine and Performance.